Thanks to folks who have joined us. We're going to wait around for another 2 minutes or so while people continue to log in. We'll share more, but we do have interpretation available: Russian, Mandarin, Spanish, and Vietnamese. And we also have our ASL interpreter with us this evening if you might need it. All right, I'm going to give it 30 more seconds, and then I think we'll be at 6:02. And it looks like it's slowing down. Well, welcome to our November 2024 provider information session. We are happy to have you with us, whether here on Zoom or if you're listening in on Facebook as well, or if you're watching this later as a recording. We're going to start with a few slides to make sure that everyone has the supports that they need to be able to listen in and understand what we have to share today. So first, we have interpretation available, and here is a visual of what it looks like in order to join that channel. I'll share this in Spanish as well. Bienvenidos, gracias por acompañarnos. Gracias por acompañarnos esta tarde. Si necesitan interpretación al español, en la parte inferior de su pantalla tendrán el icono que es un globo, un mundo. Ahí pueden seleccionar su idioma español y escucharnos por ahí. Estamos intentando grabar. We're trying to record English and Spanish here, so apologies for the several messages. And we'll go on to the next slide here. We won't have an open chat this afternoon, but we have the Q&A feature available, so you are able to go in there and type in your questions into the Q&A. You see the picture here as well. It's two little message boxes. Join us there. We'll be taking questions in between each topic, and our speakers today will also pause to ask if there are questions. So as those questions come up for you, drop them into the question and answer feature into that little chat box. And then we'll have our colleague Ronnie this afternoon who will be reading them, and we'll try to get to as many questions in regards to the material. Here's our agenda. We had a couple changes over the last couple weeks, but we finalized it. And first, we'll start off with, we have Stacy Matthews with us from Oregon Health Authority, who will share some immunization information. We have Valeria Anderson, who will share information around Find Childcare Oregon Provider Portal. And then we'll have a general agency and program updates to close the evening off with. So at this point, I'll hand it over to Stacy Matthews if you'd like to introduce yourself and walk us through.
Thank you. Hello, my name is Stacy Deassis Matthews. I'm the school immunization coordinator at the Oregon Immunization Program, and I use she, her pronouns. I'm excited to connect with you today about immunization requirements for childcare programs and give you a picture of what's going on currently with some vaccine preventable diseases. So let's journey down this road together on this lovely fall day, like this picture from the old highway by Multnomah Falls. And I'll also share some pictures that I've taken across the state, as I sometimes get to travel to meet with childcare and school staff like you in person. Next slide, please. So first stop on our trip, I would like to ask, why do we have immunization requirements for kids in childcare? And first, what do I mean by immunization requirements? Well, all states, including Oregon, have laws saying kids have to have certain immunizations to go to school or childcare, or an exemption on file. So why do we have these laws? Next slide, please. So last year I visited these redwood trees in Curry County in the southwest corner of the state. And yes, we do have redwoods in Oregon. These trees are so strong and resilient and remind me about why we immunize. Well, we all want schools and childcares to be healthy and safe. So just like these trees, children can really thrive. Please click once. And childcare providers are the only ones who know who gather in their space. And childcare's settings, kids have close interactions, so there is an increased risk of disease spread. Next slide. And we prepare as much as we can. Childcare programs check kids' records and submit immunization reports every year. And we do this work because things happen. So a little story. This summer, I was lucky to take a road trip and go camping in California to the Sierra Nevada mountains, which are known for bears. And every time we checked into a campground, the park ranger would explain that they have these big metal boxes that you store all of your food in so the bears can't get it. Well, at our third campground, like this one at Lake Tahoe, we unpack and put all of our food in the metal box just to be prepared. But we haven't seen a bear on the entire trip. Next slide, please. But an hour later, wouldn't you know it, a bear walked right through our camp. And we didn't expect that we would see a bear and have to rely on that metal box, but we're sure glad we did. Just like childcares don't want to be in a position to have to use those immunization records that you collect in case of a disease outbreak, but it's important to be prepared just in case. Next slide, please. We have a process in place that's part of Oregon's immunization law that helps make sure everyone is prepared. So this process is an annual review of all kids' immunization records. And here's a timeline showing the process. So when starting care, a newly entering child's record must show at least one dose of each required vaccine or an exemption. Then in the fall, childcare programs and schools work with families who are missing immunizations to give them a chance to get updated on vaccines. The third Wednesday in February is the deadline by which all kids' records must be updated with documentation of either immunization or exemption, or the child must be sent home. And the deadline is in February, so that exclusion is really a last resort after programs have had a chance to work with parents and guardians to voluntarily get their records updated in the fall. And in the spring is when we do our data collection for the year. Next slide, please. So you might be thinking, that sounds like a lot. I need to know what path to start down to get started, like this path at Green Lakes in Central Oregon. And I'm going to go into some differences in requirements for different sites, but everybody's going to start down the same path. But to help determine where you go from there, I wanted to bring up a poll question now to find out what type of child care sites do you have. So hopefully you can go ahead and answer this poll question, whether you're a certified family child care home, a registered family, certified center, school age center, license exempt, a recorded preschool, or recorded school age. Okay, and hopefully we can share the results. Is that possible? All right, so we have a good mix here tonight of certified family, certified center, and registered family, and a few of the other types as well. And of course, more in the Facebook. So I will go ahead and speak to each of these and your immunization requirements. You can go on to the next slide, please. All right, so the first step for all types of childcare programs is to collect immunization records for children. So sites that have to collect records include certified childcare centers, certified family childcare homes, early intervention programs, Head Starts, any type of preschool, they're licensed, unlicensed, recorded, and registered childcares. Everyone needs to collect immunization records for children in their care. The second step is submitting annual immunization reports. And all sites have to do this except for registered childcares who don't have to submit an annual immunization report. Next slide, please. So I mentioned all site types must collect immunization records for children in their care. What do we mean by immunization records? Well, it's a couple of different things like this waterfall, Lower Kentucky Falls by Reedsport, with a couple of different tiers and pieces to this waterfall. So what are the different pieces of information that child cares need to collect? So for each child, you need to collect a record of immunization dates. And if anyone has an exemption, you need to collect records of those too. That might be a non-medical exemption, which is if a parent or guardian has a religious or a personal belief reason that they don't want a vaccine for their child. Or it could be a medical exemption, which is if a child cannot be vaccinated for medical reasons. Next slide, please. And one place to get these records is directly from the child's parent or guardian, who need to fill out the form that you see here. It's called the Certificate of Immunization Status. This form is available in 18 languages. It's bilingual, English plus one additional language for all of these languages on our website. So if a parent fills it out in a different language, a childcare provider can read the English translation. And you can find links to this form on our website, which is www.healthoregon.org/school packet. And that's on the slide as well. And I'll share that website again later. Next slide, please. The other place you can get an immunization record is from a system called Alert IIS. Alert IIS is an immunization information system that almost all of the clinics in Oregon put all the immunizations that they give into. If you're a registered childcare provider, you can get a copy of an alert record for children in your care, and you'll need to call the alert help desk for that. If you are a certified child care provider or a preschool of any kind or a Head Start program, you can sign up for your own login to this system. Next slide, please. When you log in, you can look up the immunization records of children in your care using their name and date of birth. Next slide. And that will take you to a screen where you can print the record, which you see circled here. Oh, it didn't circle. Okay, I'll tell you where it is. It is school record. That's at the top. It's a button you push. Next slide, please. And it looks like the certificate of immunization status. An alert fills in the dates of immunization for the child, and you can print this for your records. Next slide, please. Now at the bottom of the screen, you'll also see a vaccines recommended section. And that is how you tell if a child is complete for vaccines or due for vaccines. This child is due for the green highlighted vaccine, hepatitis A, and complete for all other vaccines. I like to think green means go. Go to the clinic and get that vaccine. Next slide, please. And you can learn more about records and how you can get access to alerts. You can go to that same website, www.healthoregon.org/schoolpacket, and we have links to trainings. There are recorded trainings that you can watch on demand and also live webinars that you can sign up for so you can ask questions. There's a training about immunization record keeping, a training about alert, and a training about how to do the immunization reports. We'll talk about reports next, but I wanted to pause just for a second here to see if there were any questions that came up yet.
Thank you, Stacy. We have one question, and I bet you it's coming up. They wanted to know, where do they submit the immunization records that they collect? Or
that is a great question and a great segue to our next section, where we will talk about immunization reports. And to answer that question, you are going to submit your immunization report to your local health department. And you can go to that same website, www.healthoregon.org/schoolpackets, and it has a list of all the health departments in Oregon and the contact person, their phone number, their email address, and their name, so you know who to submit the report to. Next slide, please. All right, so all sites except registered childcare facilities need to submit reports. So this picture is from Gales Creek near Tillamook last fall. And some of you might be thinking, Stacy, why do you have a picture of the fall leaves here when I've done this before and my report wasn't due until the winter? And you are correct, but I want to emphasize, now is the time in the fall to get prepared. Look up kids' records and alerts and let parents know if their child is missing a vaccine or if you don't have a record of something. Reports are due in the winter so that you can use the fall to collect your records and to work with families to get updates, so as many kids as possible have complete records when you have to turn in these reports in the winter. Next slide, please. And a little more about these reports. They can be found on the same website. There are 2 different due dates for different pages of this report. So the first part of the report is counting the number of children who are complete on their immunizations or who have exemptions or who are missing documentation, and sending information on those missing documentation to the health department, because the health department sends official letters to families. This part of the report is due in mid-January. The second part is a summary after all the children's records have been updated after the letters are sent. And this updated report is due in late February or early March, depending on the year. Next slide, please. So in this vast universe of information out there, like this picture of the universe above Mount Hood, where can a child care program go with questions? Well, the local health department is the best contact for child care facilities with any questions regarding the immunization review process. The contact person for your local health department is on that same website, www.healthoregon.org/schoolpacket. Next slide, please. So this is a lot of work that you're doing to help keep kids healthy and safe. Here's a picture of the Painted Hills in Eastern Oregon outside of Mitchell, and I wanted to paint a picture for you of what are the results of all of your hard work. Next slide, please. Here is the percent of kids complete for each required vaccine in Oregon. Yellow is our preschools, Head Starts, and certified child cares. Because we don't get reports from registered child cares, they're not included in these numbers. Green is school-age kids. And for each required vaccine, the immunization rate is up around 95%. So that is really high. And this annual review process provides an opportunity for children to get updated on vaccines at least once a year. And it's really impactful in getting kids immunized. It helps protect kids against 11 different diseases. DTaP, that's diphtheria, tetanus, and pertussis. Polio, varicella or chickenpox. MMR, that's measles, mumps, and rubella. Hepatitis B and hepatitis A. And Hib, which is Haemophilus influenzae type B. Next slide, please. Then I wanted to share what's going on in Oregon that makes this so critical. So you may have heard some talk, like these sea lions in Newport like to talk, about some disease outbreaks over the summer in Oregon, specifically measles and pertussis. Next slide, please. So measles is a virus that spreads through the air when an infected person coughs or sneezes, and symptoms appear 1 to 2 weeks after contact with the virus. Common symptoms include a high fever, and it can be really high, like 104 degrees, a cough, runny nose, red watery eyes, and a rash. And measles can have serious health complications, especially in children younger than 5 years old. Those include pneumonia and encephalitis, which is inflammation of the brain. And 2 doses of MMR vaccine are about 97% effective in preventing measles, and 1 dose is about 93% effective. And the vaccine lasts your whole life. Next slide, please. This graph shows measles cases in Oregon over the past 5 years. We saw 0 or 1 case in the past years, but there was an outbreak this summer that caused 31 cases. None of these 31 cases were up to date on measles vaccine. And thankfully, that outbreak is over. Next slide, please. Let's move on to pertussis, also known as whooping cough. It's a bacteria that spreads through the air when a person coughs or sneezes. It usually takes 5 to 10 days for symptoms to appear, but it can be as long as 3 weeks. And early symptoms are cold-like, but then there's a second phase of the illness, and those symptoms include a rapid, violent, and uncontrolled coughing fits, and this stage lasts for weeks. Babies younger than 1 are at greatest risk of getting whooping cough and having severe complications. And it can cause long-term respiratory and neurological problems. From 2000 to 2017, 307 people died in the US from pertussis, and most of those were babies. The best way to prevent whooping cough is to get vaccinated, and CDC recommends whooping cough vaccine for everyone. The vaccine does wear off over time, so boosters are recommended. Next slide, please. This graph shows pertussis cases in Oregon in each of the last 5 years. Pertussis goes in waves, and we're seeing a high number of cases this year all over the state. When I made this slide, there were 740 cases, but now I just read today there are more than 800 in Oregon this year. You can check with your clinic or pharmacy to see if you are due for a booster, because adults get boosters too. And I especially recommend this if you work with infants who are at highest risk of disease complications. Next slide, please. Here's a picture of a tree growing out of lava rocks near Bend, all alone. And if a case of disease comes up in your childcare, I want you to know you are not alone. If there's a case of disease like measles or pertussis, call your local health department. It's the health department's job to help. And it's something that you prepare for, even though you might not be thinking about preparing for a disease outbreak. You have all the immunization records. You know which kids are susceptible because you know who's missing immunizations and who has exemptions. Next slide, please. And these are sea stars from the Oregon coast. And all of you are the stars who make this process work. A few keys to success: start in the fall, like all of you are doing right now. Use alert to find missing records, and contact parents now to give them time to get their kids updated on immunizations. And thank you for all of your hard work in making sure kids in Oregon are healthy and safe and have a chance to get updated on their vaccines at least once a year. Next slide, please. One more encouragement to go to that website and check it out. We have resources like this one, a parent flyer that's in 18 different languages that you can share. Next slide, please. Here are the references to the statute and administrative rules if you need them. Next slide, please. And thank you. I'm happy to answer any questions that you have. And my email address is on this slide as well if you think of any questions in the future.
So Stacy, we do have one question that came in and says, as a certified provider, can we have access to the vaccine records and the training to fill them out?
Yes, so as a certified childcare provider, you can get access to the records through the Alert IIS system. If you go to that website, you can click on the place where it talks about training. That will take you to a training website where you can watch an on-demand training, and it will tell you how to fill out the registration forms to get access to that system, how to use the system for your immunization records, and how to tell whether a child is due for vaccines or not.
So, Stacy, that was the only question that we had in the Q&A. And thank you for taking us on this journey.
Thank you so much. Happy to be here this evening with you all.
Stacy, wait, I think we have one more coming in just now. I'm going to ask Karina to help me out with that. Should be able to speak to that.
Sorry, which question was that, Ronnie?
We have just the one that's in a Q&A right now. It's in Spanish.
Oh, I'm sorry, I missed it. Yes. Essentially asking around timeline. When do the records need to be completed and turned in?
Yeah, so those for certified childcare programs, those immunization reports are due on January 15th this year to your local health department.
And Stacy, before you take off, we wanted you to know that there was a comment that said, thank you for the clarity and the beautiful photos.
Oh, thank you.
So that's it for the Q&A at this time.
Thank you, Stacy. Thank you, Ronnie. We'll go ahead and transition at this point to our next agenda item, which is Find Childcare Oregon, and we have Valeria Anderson with us. Valeria, thanks for joining us. I'll hand it off to you.
Hi, hello everyone. My name is Valeria Anderson, and I am the Find Childcare Oregon Lead Project Specialist at TRI. So we're going to talk a little bit more about what Find Childcare Oregon is. So next slide, please. Okay, so we have a couple agenda items here. So we are going to talk about what Find Childcare Oregon is, how you can update your profile. We're going to talk a little bit about childcare referrals and Find Childcare Oregon and the market price and supply study that we are doing this time around of the year. Next slide, please. So what is Find Childcare Oregon? And many of you may be asking yourselves this question, but Find Childcare Oregon is the state's database, and we collect childcare program information for all types of programs. So licensed programs, recorded programs, and also license exempt programs. And in this database that is Find Childcare Oregon, we capture all sorts of things. So we capture what is provider support, technical assistance to programs, as well as providing the childcare referrals through our database for those who are seeking childcare. And this program information is very important to us to study the whole childcare field in Oregon. And this type of studies allow us to perform statewide reporting. Next slide, please. Okay, so we're going to talk about how you can update your information. So there is two ways in which you can update your information in Find Childcare Oregon. So one is by sharing your program information with your regional childcare resource and referral. You may notice that your childcare resource and referral contacts you every 3 months or every year, depending on what type of program you are, and they ask you certain questions about your program. And when you provide that information, this information goes directly into your profile in Find Childcare Oregon. And the other option that you have to update your program is updating it by yourself through the Find Childcare Oregon provider portal. and you can access it 24/7. And you can make these updates anytime that you feel like your program information needs to be updated. Next slide, please. Okay, so now we're gonna talk about how to update your profile. And you must have received an email from Find Childcare Oregon. If you are signed up to receive text messages, you can also log into your account through that text message that you receive. And this will come directly from Find Childcare Oregon. Then you will click the link that is located at the bottom of the email or the text message that you received. And then you will automatically be into your profile, and your email address and your password will be automatically entered by the system. You don't have to know this password. This password is automatically created by the system, and it's a temporary password. So once you log into your account, you are able to change this password. And then the next step is once you click in the login tab, you are going to receive a code via email. And this code is meant to authenticate your account and making sure that it's you who is trying to access your program. So it's just a safety step. So we are making sure that nobody else is accessing your program. And this code is going to be a code that you need to enter in the authentication code box, that it will be located in the login process of the system. Next slide, please. So now once you're logged in the system, we'll show you a series of boxes. And with this information, you can review and update their information as needed. You will be able to see what is currently in your program record, and you can update all the information as you need it. You can also translate the website at the top left corner of your screen and select the preferred language that you would like to see this website. And then at the very, very last pop-up box that you will see, you will be able to select your preferred referral status. So you can be open for referrals or closed for referrals. And after updating the information in the pop-up boxes, you can review additional information in the About Our Program section. And you can enter different stuff such as the environment of your program. If you have a philosophy in your program, you can also select that information in there and write a text for families that they can see when they are seeking for childcare through our database. And at the very end, once you are sure that you're done reviewing your program information, you can click Save, and all of your records will be saved in there. Once you saved all of these records, this update that you just completed will be sent to your regional childcare resource and referral, and they will go through the information just to make sure that everything is in order and that no information is missing. So now, once they approve those changes, you will be able to create another update later on. And you can do this once a week, once a month, as many times as you would like to do it. Next slide, please. So who are our users in Find Childcare Oregon? So our main users are families, and families are able to search for programs that are open for referrals. If your program is closed for referrals, you will not be visible in Find Childcare Oregon. So by using different filters, parents will find programs that fit their childcare needs. And our other users are providers, which is you. And you will use this provider portal to update your program. And you can keep your referral profile current and say, today I do want to accept referrals, or maybe today you don't want to accept referrals. Or you can update other information so you can support your business, and you can also support those who are seeking childcare referrals. Next slide, please. So now in an state level, who are our users? So we have the childcare resource and referral agencies, and they utilize our Find Childcare Oregon system or database to enroll new programs, to track the programs that are already in the system. They also update the programs and they provide support to the childcare programs in the region. And then we have 211 Info. And 211 Info accesses what is Find Childcare Oregon, and they provide childcare referral list to those who are seeking childcare referrals. And they base these referrals on location, ages of care, the operational days and hours that fit the family needs, and also financial assistance, among other characteristics of the programs. 211 Info does not perform program updates, but they utilize the information that is in our database to be able to provide those childcare referrals. 211 Info is also a great resource for everyone, since they offer different resources in the state, such as utility assistance and food stamps. Next slide, please. So now the Find Childcare Oregon referral system, it is designed to support families to make informed decisions about the childcare for their little ones. And these include referral listings of the childcare programs. And something that we will always like to clarify is that referrals are not recommendations and do not relate to the quality of childcare. And it is the responsibility of exploring and determining what is best for the child on the families. So families need to contact the programs and make sure that the program meets what the family and the child needs. Next slide, please. So we're going to talk a little bit more about 211. So 211 is a private community-based and nonprofit organization in Oregon and Washington. And they serve the whole state of Oregon and a couple of counties in Washington state, mostly those ones that are right in the border with Oregon. And 211 Info is the agency that is contracted by the state to provide these childcare referrals that are free and customized. They also, as I mentioned before, provide additional community resources such as housing support, utility assistance, and access to food stamps. Next slide, please. So why 211? Well, 211 has the capacity to support families outside of regular office hours. And they also have support available in different languages. And this is what makes this agency more accessible for those who are seeking childcare referrals. Sometimes, you know, parents work office hours and they cannot call them while they're at work. So 211 Info has operational days that are very flexible for families to be able to call them whenever they have time. They are open Monday through Friday from 7 a.m. to 11 p.m. And Saturday and Sunday, they are also available from 8 in the morning to 8 p.m. The languages that they offer is English and Spanish, but they also have interpretation services available in other languages. Next slide, please. So now we're going to talk about the market price and supply study. So we're inviting all of the programs in Oregon to participate in the market price and supply study 2024. You probably have heard about this. We perform this study every 2 years. So back in 2022, we did the same study, and back in 2020, we also did it. So the Oregon Market Price and Supply Study is focusing on collecting information about the price and the supply of childcare in Oregon. So the voice of all of the programs is very important because you are representing the childcare in Oregon, and we need to know that information to be able to support you. So by participating, you are also helping families to have equal access to childcare, and you are also helping state and national leaders to understand how childcare works in Oregon. Next slide, please. So please don't forget to participate. You have until December 31st to participate in the market price and supply study and be the voice of the childcare programs in Oregon. So even if you are license exempt, even if you are a registered family, and even if you are not completely utilizing your full license capacity, it is very important for us to receive this information from you. So feel free, you can participate in the market price and supply study by accessing your Find Childcare Oregon provider portal and updating your profile. And you can access it at any time, as I said previously, any day of the week. You can also go through your CCR&R, your Regional Childcare Resource and Referral, and they will ask you a series of questions, and then they will update your Find Childcare Oregon profile for you. So you can do it in both ways. Next slide, please. So now it's time for questions. I don't know if anybody has any questions, if you guys can see any questions.
Yes, we have a couple questions for you. An individual said, my certified center recently became an ERDC provider. If I update my profile on Find Childcare Oregon to reflect that, will it automatically show on the 211?
Yes, so a little bit of clarification here. 211 info uses Find Childcare Oregon database. So 211 info access Find Childcare Oregon and provides childcare referrals based on the programs that are open for referrals at the time. So if you update your Find Childcare Oregon profile, it will be reflected in your profile. So when 211 is providing childcare referrals, that information will be displayed in there. So it's not two different databases, it's the same database. The only difference is that 211 is using our database and they are the ones who are performing those searches for families.
Thank you. So has 211 expanded their live person availability beyond the regular work hours? Usually they have a live person during working hours, and wonder if they expanded those hours.
Yeah, so they work Monday through Friday from, I said it earlier, I believe it's from 7 or 8 in the morning till 11 p.m. and then Saturday and Sunday from 8 a.m. to 8 p.m. And they are also open on holidays, so it is a very good resource for anyone that is looking for childcare or additional community resources.
Okay. And does 211 also access preschool marketplace?
What is the preschool marketplace?
I'm
Just
not
clarification.
sure. Perhaps we can get more clarification from this individual.
Yes.
So, and then in the meantime, I can go ahead and ask you this one. This individual said that either they didn't receive or they deleted the email to do the survey for the market price study. And they have a postcard, but when they go in, it doesn't automatically give them the name and password like it would with a link.
Yes, so we will be sending another round of emails actually tomorrow, November 15th. And all the programs that have not completed the market price and supply study are the programs that will be receiving this email or text again. If not, she can email us at the Find Childcare Oregon email address, which is the fcco@wood.edu. And we can send that to her.
Thank you. Okay, we have the clarification on the preschool marketplace. It's an online database for 3 to 5-year-old preschool programs. It's created by United Way, Intel, big organizations working together to show all the preschool options in the area. So the original question was, does 211 access that marketplace to give referrals for preschoolers?
I necessarily don't have that answer, but I do know that 211 have their own database for school age programs or summer camp programs when it's needed. So that would be something that I can investigate and then return to, like give you back that information. We work with 211, but 211 does have additional resources in their own database. The only database that we provide for them is Find Childcare Oregon for licensed and unlicensed programs in Oregon.
Thank you. And just another clarification for the hours that 211 is open, is it always a live person during those times?
Yes.
Okay, thank you. And we have one more. What is the benefit of the market cost study? What is the information used for?
So the information is used to know the supply and the demand of childcare. This allows sometimes the union to be able to bargain the certain rates like the ERDC rates, and it is also utilized as a federal level to be able to show the needs of childcare in Oregon. And it also paints the picture of what parts of the state need more support and need more funding to be able to provide care. So it let us know, this type of study let us know what are the desert areas of childcare in Oregon. Usually is on it is on the east side of the state, but it allows us to be able to provide that information to our national leaders and our federal leaders. And it also is, this information is utilized by the union too.
Thank you so much. That was it for our questions.
All right. Well, I'll stick around. If anybody has any additional questions, I'll be here.
Thank you.
Thank you.
Thank you, Valeria, for all of that great information and for taking the question. If others have additional questions, please feel free to keep submitting this to the Q&A feature. And Valeria has shared her email, which we're also happy to drop into the chat here if that's helpful. With that, we'll go ahead and transition to our last agenda item of this evening, which includes our agency and program updates. And I'll ask Allison to introduce herself and walk us through these last couple of slides.
Thank you, Karina. We just have 3 updates tonight. I know sometimes we have several for you all. If you go to the next slide, I'm happy to share. Thank you. So we have been updating you all about the family childcare rule revision for close to a year now, and wanted to give you one last update before these rules go to the Early Learning Council in December. So we started engagement back in January with listening sessions. We had an online feedback form available. We facilitated community work groups. We paused to present all of that feedback to the Early Learning Council. And then this fall, we hosted a rulemaking advisory committee that consisted of parents, family childcare providers, and other system partners like CCR&R representatives. And that rulemaking advisory committee helped to look at the rule language that will be revised for the certified family and registered family rule sets. So the goal here is really aligning the rule sets both across family childcare, but also with some of the certified center rules. We want to make sure that the rules are easy to understand, they're in plain language, and that we're eliminating anything that was duplicative. So next step is the Early Learning Council meeting in December, and then our proposed effective date for the rule changes is not until July 1st. So if those rules pass in December, we'll have just about 6 months to facilitate training for everyone. We will have videos available and be on the lookout for more information from the Child Care Licensing Division about those opportunities. And Karina, we can go to the next slide. Another update from the Child Care Licensing Division. We have had this inspection feedback form available on our website for a while and like to remind you all that it's there. So this is an opportunity for you to provide feedback about your licensing visits. So we want to hear from you of what's working well, what could be even better. This is not a place to submit a complaint. If you do have a complaint, please contact your regional manager or call the customer service number at the bottom of the slide here. This feedback form really just helps us understand what your experience is as childcare providers. So I'll put the link in the chat as well. And one more update here, Karina. Okay, so lastly, DELC is working on developing an ERDC guide for families. We have an employment-related daycare provider guide, but we have not had a family guide in several years. So as we're developing this, we thought that childcare providers would have helpful information about what families are asking you about related to ERDC. And we want to know from you what should be in this ERDC family guide. So I'll add this link to the chat as well. There is a guide for families, but this is your special link for childcare providers. And this survey or feedback form will be available until the end of the month. So it closes November 30th. And I think that's all, Karina. I can hand it back to you.
Thank you so much, Allison. Thanks to everyone who's joined us this evening, honestly. We don't see any more questions in our Q&A, if that's correct. So just as a reminder, our recording will be available on the website. You can also find the recording on our Facebook page. And as always, we're available for questions. Our next provider information session is scheduled to be in January, so we'll see you then. And lastly, just want to appreciate the time you shared with us this evening. We know you have long work days, busy schedules, and it gets dark early now, which also makes it a little bit harder. So again, appreciation for your time. Thanks for joining. May you have a wonderful evening and a wonderful weekend.